Welcome to MidState Medical Center.
Here at MidState, we do everything.
We offer knee replacement, hip replacement, shoulder replacement, elbow replacement, small joints of the hand replacements. We offer the full gamut of replacement of joints that need to be replaced.
We'll do pretty much all of the elective surgery you have at any other hospital.
There's really nothing in the realm of orthopedics that I or my partners aren't comfortable handling.
Minimally invasive surgery predominantly speaks to arthroscopy.
What arthroscopy is making a very small incision, putting a camera into typically a joint, inflating it with salt water, and then being able to work in a minimally invasive way.
In the past, if somebody had knee pain or a particular malady of the knee or the shoulder, then you'd have to make a very large incision and go through lots of soft tissues in order to get down there and traumatizing those soft tissues on the way.
We will scope ankle joints, knee joints, elbow joints, wrist joints, shoulder joints. There's just more and more that's done through smaller incisions.
Patients are much more comfortable right away. They can generally rehab more efficiently given the lack of scar tissue that tends to form from open incisions. Patient satisfaction rates are extremely high with it.
We see all ages, from infants who hurt themselves or toddlers that hurt themselves playing sports, in addition to teenagers, high school athletes, college athletes, I even take care of some professional athletes, in addition to most commonly the weekend warriors. I think that people are playing sports and varying activities and hobbies up to a much later time or stage in their lives. A lot of sports medicine is a quality of life issue, so it's a discussion with the patient what their expectations are and what we can do to get them back to those types of things that they like to do on a daily basis or on a weekly basis or as a hobby. These days, with the minimally invasive procedures, people are able to have these surgeries and get back to doing things that they want to do in a higher quality of life at a sooner time.
Spine surgery has changed dramatically over the last 20 years, and there's a whole cadre of procedures that are possible today that weren't done 20 and 25 years ago.
We have two spine-trained specialists, both neurosurgery and orthopedic surgery, working together rather than one with an assistant. You have them talking about certain cases and managing very complex cases.
Some of the happiest people we have, or I have in my practice, are people who've had simple disc ruptures. I can take a disc out of somebody in the morning and send them home in the afternoon, and some of them taking Tylenol pain-free.
And I think there is a huge advantage to having the abundant resources that we have here for that. After surgery, patients can expect us to fully follow them and provide whatever they need thereafter. If it's an athlete, we get them back on the field. If it's somebody who's looking to walk after a knee or a hip replacement, we follow them until their expectations are met. We have a full gamut of services in order to make sure that happens.
The physical therapists are actually dependent on us to tell them what we want them to do, what the range of motion progression should be, what they're allowed to do as far as strength building and range of motion activities throughout that post-operative course.
You can do any surgery and procedure on a patient, and they won't get better if they're not invested in the recovery and do what they're supposed to do and listen and learn.
Patients have a huge role in making sure that they do well.
The quality of care here is excellent.
The hospital here actually has been awarded a Blue Cross Blue Distinction Award, which is awarded to those hospitals that do joint replacements at an extremely high quality level.
This hospital has as much state-of-the-art equipment for any particular procedure as any other hospital.
What you get done here is equivalent to any type of procedure that would be done anywhere.
We require board certification from our physicians. During our reviews from the Joint Commission, which accredits hospitals across the country, we have been praised for the way we conduct our credentialing here.
Our complication rates are extremely low. Our quality is very high. Our staff is wonderful.
One of the simple advantages is that this hospital has all private rooms, so you never have to worry about having a roommate while you're trying to recover from surgery.
We are very committed to outcomes, very committed to patient care.
The majority of people who work and treat people here live in the community, and they treat their patients the way they treat their neighbors.
When I see patients in follow-up and they're doing well, it makes me feel great.
You don't treat x-rays, you treat people.